In 1991, the Saint Regis Mohawk Tribe opened a new 14,400 square foot health facility. It replaced the old tribal clinic that opened adjacent to the old community library in 1972. In the summer of 2018, a new expansion project got underway to again respond to the growing needs to the Akwesasne community. Health Director Mike Cook discusses why the building expansion is necessary for staff and community.
The demand for our services has grown, and to meet that demand, we need more space. This program here is really the third location. This space that we currently occupy was designed almost 30 years ago. And so the growth just in the last 10 years, our number of charts have gone up about 2,500 charts, more additional charts in the last 10 years. The numbers are growing. People are coming home. So in 2017, we recorded some 107 births, and we certainly anticipate that to increase for 2018.
I hate to go back to the old days, but back when I first started, we saw patients, but they were never as complicated as they are today. Today, our patients, because of diabetes, have more kidney problems. Hypertension is very much more difficult to treat today. And I think more mental health components as well. People have more depression, anxiety, post-traumatic syndrome. You know, we deal with trauma every day. The trauma sometimes supersedes everything, and it makes the diabetes, the blood pressure, the kidney problems, all of that much worse.
So the demand is growing. Space is we need more exam rooms. Our nursing, our medical staff just needs more space to do the work most efficiently. Our pharmacy, our lab are two crucial parts of the program. Especially in pharmacy, the need for greater space is for patient education. The location of it is just really not ideal to do the proper education for the complex situations, diagnoses that our community is experiencing right now. So demand and the space to efficiently meet that demand.
Saint Regis Mohawk Tribe's Capital Project Manager, Colleen Thomas, led the design efforts with the clinic staff and shares information about the features of the project.
Some of the special features are, for me, the most exciting part of any project is making it energy efficient. So this project, like every project the tribe has done in recent years, was designed to meet or exceed the current energy codes. Some of the other energy efficient elements are high efficiency light fixtures, room occupancy light sensors, and light tubes that go in the roof to bring natural light into areas that don't have access to it. And then we're also building a 75 kilowatt solar array. So part of that will be roof mounted, and then part of that will be ground mounted on the back side of the site here. So barring any major issues, this project will be completed the end of December 2019 or early 2020. And Health Service will then have a beautiful new facility, like roughly 37,000 square feet. That includes the addition and about 15,000 square feet, so about 75 to 80% of their existing building is getting renovated.
The clinic expansion continues several major capital projects the Saint Regis Mohawk Tribe has undertaken on behalf of the community over the past several years.
Several years ago, maybe 3 years ago, we started putting money aside primarily from the third-party revenue collections from insurance at the facility, as well as a couple of federal lawsuits within Indian Health Service and the BIA, totaling about $2 million there. So to start the project, we had about $5 million put aside. Under the Affordable Care Act, a Medicaid expansion took place within New York State, so higher income folks were eligible for Medicaid coverage. Because of that fact, the revenues that we're collecting at the clinic made it possible to start the fund and then have a good down payment of $5 million towards the project. Overall, the project is roughly $7.8 million in total expense. Additionally, we have entered into a lease agreement with Indian Health Services. Many tribes do. We just started it last year whereby we look at the square footage of our health facility, our Partridge House, and our Diabetes Center, and we rent those facilities back to Indian Health Service. And through that arrangement, we've increased our revenue by about $400,000 a year. That revenue as well will be used to pay off the debt service. So we're really happy that no tribal general funds are required for this expansion, which is really good because we have so many needs elsewhere that those dollars can go towards. And so by thinking about it and analyzing it that way, our staff have really come up with a great way to accomplish this project without impacting the tribal budget in other ways. So that's a real plus of this overall arrangement.
We'd just like to thank the community for their patience and their cooperation during this time. The construction is going to cause some confusion for some people, and then we're going to move on into renovations of the inside of the health facility. So it's going to be a process that we hope doesn't disrupt our services very much. So we would just like to thank everybody for their understanding while we continue the process.